the light of dimensions have nothing to do with the polygamies. As we go on, Mr. Oppositions, it is clear that nothing to go against when Dr. Jai mentioned that the noise look at the mental health of the patient first before the physical appearance of the patient. Honorable Speaker, my point as a Prime Minister, I'm listening P.F. Kamara. So the structure of my debate, I'm going to define my motions, give my key terms, the point of my motions. What point do I get my debate from? And accept POI if possible and summarize after summarization and conclude. But in this debate, we have 4 time. We have 4 times that we need to move. One is the mental health. What is mental health? How mental health work? Mental health deal with the consciousness of mind in head. And physical health is the being of what we see, feel, touch. Anything you're seeing, feel or touch can be your physical appearance or physical health. But services is the system of what? Of a supplementary public need. Like what is the need of the public? It's what we call services. So you cannot tell me that just probably need mental health, no, or a probably need physical health. But I'm yet, as a Prime Minister, to say that yes, the government should choose or take mental health as priority than physical health, because a mental health is already in the mind, and anything that affects the mind affects the entire physical appearance of the body. Now, a budget is an estimate income. A budget is an estimate income of a period. Like, what is the estimate? What do we set? So at least to reduce the mental health rate. Like, let's look at some of those things in Africa. Like, according to WHO, from a statistic, it says that in every 10 people, 5 to 7 are mental health patient. 5 to 7 are mental health patient. So among this group, if we're at 100, yeah, then we have about 50 to 70 mental health patients. Mental health is not just about like what you think of, but it's about your feeling. And how do you feel in your mind? What expression do you have in your mind? What is your thought? That's how mental health is like. And in 2014 to 2022, according to WHO report, among 80% of youth and mental health patients are suffering from mental disorder. So how do we feel when we talk about mental health? 80% are suffering from mental disorder. A mental health can be in your house, a mental health can be on the street, a mental health can be in the school, wherever you are, you're having a mental health. How do you feel when someone calls you like you're a mental health patient? It's gonna be abnormal, but it's the right, because you don't even know what mental health type of health you are going through, but you need to understand how mental health functions in your body. Now, according to Fatu Network, the statement from Tanga Tanga Hospital, like every year from 2014 up to date, every year the patient, the psychiatric patient in Tanga Tanga increases. And these are mental health patients. They are not physical health patients. Every year, mental health increases from 5% now, increase to 10% every year in Tanga Tanga Hospital. Now, how are you going to feel if it is increasing, no decreasement? On mental health, based on my research, a mental health can be from depressions, anxieties, agitations, and stress. Most of the mental health we are going through today as a student is stress, because you have anatomy to study, you have physiology, and some of you are like, anatomy is my problem, but I'm going to deal with it. I want to ask this question. Are you really going to feel? How are you going to feel, and how are you going to accept if you are a mental health patient? We accept that you're a mental health patient. No, you cannot accept because you thought it's an insult. It's not an insult, it's in our body. We move for it, it's in the mindset. Psychologically, it needs to be allowed, even though sometimes it is rejected, but it must be allowed. Okay, some mental health can be caused based on adaptation of drugs. If I'm talking about drugs, let me specify the drugs. We have type of drugs. Like the drugs that you're going to take, like nicotine, cocaine, causes some mental harm. But most of our mental health condition these days in Africa, most of our mental health problem we are facing based on psychologically are earlier marriage for women, men smoking drugs. Like if you are addicted to smoking drugs and female, like you want to man peer pressure because my friend is having anything like I want to do, so my friend is doing this, I need to do it, and your period of point gonna affect you based on your psychiatric process. So, secondly, I mentioned that I'm gonna give you some key points, which I give, and my key point are genetics. How do you feel when you have family pressure at home and you need to study in the school, and at the same time you need to go to work to feed yourself? You have mental disorder appearance there. So by right, with the government, it's compulsory, or the government should take mental health as priority than physical health, because mental health affects almost 80% of people around the world. Out of 100%, if 80% is affected of mental health, how many percent do you expect to have to be normal in the world? How many percent of people? What is the percentage? What will be the rate? What is going to be the rate? Honorable Judge, Mr. Speaker, has you seen this debate? So fine.
Out. And yeah, we are proud. We are all Iowa students right now. We are proud. And yes, the cooking starts. The cooking is about to start. So, all right, the opposition leader, you can come forward.
Honorable Speaker, respected judges, esteemed members of the House, I am Sadi Bujonga from Sami Institute of Nursing and Allied Health Sciences. Today we proudly stand to support against the motion, which states that this House would prioritize mental health services over physical health. I have my points that I want to emphasize here, which will debunk all what he talks about here. Which he states that mental health should be prioritized over physical health. My number one point is that mental health should not be prioritized over physical health. We all see people that we live in with our houses, when they are physically unable or unable when they are physically unable, we always see how they are frustrated, like they have diabetes and then it gets severe until it leads to amputations. It leads to amputations. Just analyze how that can cause you stress and meditations and can lead you to mental health. And my number two point is that if you are physically disabled, sometimes you even prefer dying because, for instance, like you having diabetes or the likes of stroke or other sicknesses, then end up making you disabled, and there is no one around you helping you to get your needs satisfied compared than before. Encountering sicknesses, how active you were, and how then you used to run your errands and then the missions and satisfy your needs. The meditations can lead to can lead someone to have even mental health disorders. So continuous stress, and it can even shorten your age, to live. So we prefer physical health and mental health. If physical health is prioritized first, all these things, will not occur. Because sometimes, if you encounter certain disease conditions or you get sickness, it leads you to be disabled, if at all those things, were battled firstly or earlier, it will lead you to meditations or stresses that that you will encounter in that situations or conditions. So, and also, I want to debunk one of his points that he made mention of, which he says that mental health, nurses should consider mental health than physical health. For instance, like you encounter a patient who is unconscious, or went to coma. Sometimes coma can lead to, up to 1 week, 1 month, or couple of days. When you encounter a patient like that, how are you going to know that the patient is unconscious or is mentally ill? No, no, thanks. In conclusion, in our stance, I stand firmly, logic and stance in our cases stands strong. For these reasons, we urge you all members of the House and respected audience to support against the motion. Yeah, which states that mental health should not be prioritized over physical health. Yeah. Any POI?
Yeah. Okay, you made mention of stress. Now, I want you to tell us. Sorry, can you be on your feet? Thank you. Sorry. You made mention of stress. So I want to ask you: is stress a physical or mental health?
Okay. Thank you for asking. For instance, like you are having a sickness or you encountering diabetes, and then that diabetes gets severe until it leads you to have amputation. When you have that amputation, it can lead you to meditations. That medications, can lead you to have stress. So that's what I mean by having that stress. You want to do any other people? All right. I'm done. Okay. You want to ask something? This one wants to ask something.
So, just for the debaters, once you assume the podium, before you start speaking, make sure that you've communicated with me to ensure that I started the timer before you start speaking.
All right.
What else we have issues there. Also, if you're asking a POI, it's normal procedure that you be on your feet when you're asking a POI. Let's observe the rule.
I'm done.
All right, yeah. So, from Summit.
Of the House, in my capacity as the Deputy Prime Minister, I am going to lay down the structure of my debate. I am going to define the motion, and then I'm going to define the key terms, and then I will bring my three solid points as to how this motion should stand. I am going to rebut the point that is being stated by my opponent. I am going to take POI if there is any POI. From there, I am going to summarize, then conclude. Speaker of the House, the motion states, this House will prioritize mental health services over physical health services in national health budget. So I am going to define the key terms here. Mental health, this is the consciousness of the mind. And then the physical health deals with the things that we can able to see and touch or feel. This is what the physical is talking about. And then services, this is the, is the supply or the need that is being rendered to the public, being it in the health sector or wherever you are, the help you offer to people. This is what we are referring to here as service. And the budget, this is an estimate of an income that is need to be spending in a particular year or at a particular event. So, Speaker of the House, mental health is an issue in this country because we have seen youths that have been deported from Europe, and then once they come to this country here, they face a lot of challenges. It will go to, it will get to the point that some of them will do things that is not in accordance with our societal beliefs. You understand? So all these are related to mental health. And then Dr. Ja made mention of something here which is very key. He made mention of empathy as part of RAPA. And then that empathy, for not to have empathy, you are giving that psychological support to a patient in order for him or her to be good in that recovery position. Because once you are rendered to the patient will feel like, oh, I am going to get better. And then he made mention of something else, that is to comfort the patient, to counsel them. Sometimes patients come to hospital, you tell them that you have HIV positive. You understand? You don't counsel them, you don't tell them anything. Even though they can, nowadays people are living with HIV. You understand? But because you just tell them you have HIV, that anxiety in them, the trauma it will lead to them, the stress they will have, they will be having, will lead them to AIDS, because HIV and AIDS are two different things. So once they get those stress in them, it will lead to AIDS. And once they have AIDS, their organs will now start depressing. The function of their organs will now depressing, and that can lead to so many things. It can even lead to their death. We have people that have been living with HIV for over 10 years. Because everything is based on consultation. And then I believe that we need to have a lot of consultants in this country. You go to the hospital sometimes, even people to consult patients about what the procedures they are going to do. It's so sad. A patient comes to lab, as a laboratory personnel, you tell the patient, I am going to conduct this test on you. The patient will ask, what is this test for? All those is based on, counseling, and that counseling are all related to psychology. We need to have people. Our health personnel need to be trained, because mind is the most powerful weapon that can render what you are doing physically. Yes, POI. All right, thank you. It seems that I have convinced them already. All right.
Okay, you said that depression, anxiety, and stress leads to mental health. So are you trying to tell us that the physical health does not lead to mental health? Or what do you have to say on that? Physical health leading to mental health?
Yes, thank you so much. Here, the topic is spending on mental health over physical health. Sometimes you can be having physical health, but what does it lead to? It leads to mental health, and that mental health is the foundation of everything. If you are on sick bed and the people are not giving you that comfort, you are thinking that I may die, or X person, or some of my friends, some of my family members suffer from the same disease, and then that leads to the death of that family member. If you don't have anything to consult you on that, do you think it will help you in your recovery position? No. So everything is based on your mental health. The mind is the most powerful weapon. Whatever you think in your mind is what you present. So if in your mind, if you are having that I will not get ill, or one of my family member died from this disease, the same thing is going to cause a lot of lot of harm on you. And then the opponent made mention of stress, physical palaver. It's like he does not understand what he is talking about. If he is talking about stress, then I don't see that it is necessary for us to have a debate on this topic, because that stress there is a mental health issue. So if he is emphasizing on that stress, now he is strengthening this motion that the government, this house should prioritize mental health over physical health. That is what he is trying to tell us. Yes. Again, we have seen that if at all the government or this house believes, and then we invest on mental health, we go around to the society to enlighten people about some of the things that are happening. Like when this corona came, people were scared. You understand? So we can just say, okay, let's just invest in physical, in their physical well-being. But what did they do? People go around to the community, to society, to enlighten them. That enlighten them there is a mental health. So mental health is the key thing here. Speaker of the House, I believe that without mental health, there will be no physical health. Without mental health, there will be no physical health. Because if you are not mentally ill, there is no way you can render physical service. There are so many nurses at the hospital. They are having so many mental trauma in their head. You understand? But if there is a support to them, some of their colleagues are there to support them. Physically, you can be here talking to people, but inside you, what is going on in your brain is the most important thing. Speaker of the House, in summary, I lay down the structure of my debate, I define the motion, and then I define the key terms, and then I bring my solid points as to how this motion should stand in this House. Then I rebut the baseless point by my opponent. I take a POI, and then in conclusion, I believe that we should invest in psychology. Even today, I have seen something circulating that UTD is now ready to offer BSc in psychology, because this is mental health is something that is affecting our society. If at all it is not a need, then UTD will not go an extra mile to bring those programs in our health sector. Thank you.
Okay. You're all from Iowa, right? That's wonderful. So I recognize the presence of the expired and former president of the Northern Students Association, who is none other than His Excellency Ibrahim Abadi. You are welcome.
Members of the government bench and members of the opposition bench. members of the House, I greet you all. Dañ wax ne dof du wér waaye kenn waxut ne feebari xel day ree. Honorable Speaker, in my capacity as the Deputy Leader Opposition, I would like to give the structure of my debate. First, I am going to define, strengthen the points of my opposition leader, debunk on some of the bogus points that these people gave, and then I will give my points. So, my opposition leader talked about mental health conditions which are acquired from physically challenged conditions, which I think was very clear. And I will say the Prime Minister did not understand the topic and he did not know what he was talking about. You said 80% of mentally challenged people were recorded some time ago, right? So did you think where those mentally challenged people, where they got that mentally challenged condition from? And also, it might interest you to know that the mental health is not the foundation of a mental health which is acquired from a physical health challenge condition. You will give me your definition of foundation later for a proper understanding. So, Honorable House, according to my own understanding, mental health is a state of being aware of your surrounding and be able to do your ADLs independently and as expected, while physical health is beyond just mental health. Physical health is the physical and mental well-being of an individual. Now, the first point I am going to give is why we should not prioritize mental health over physical health is because mental health isn't life-threatening. I guess you people will understand. If someone stands here, someone who is having depression or anxiety, the person is suffering from mental health. And if another person is to stand here from probably hypertension or cardiac arrest, so who is likely to die first? Obviously, it's the one with a cardiac arrest issue and not the person with depression. So, I think the fund of the budget should be given more to mental health, physical health more than mental health, because you will see a lot of people that will go to the hospital and you will find it very difficult to access to health care only because you're not having enough money to pay for probably your lab results, or probably you went to the pharmacy and there's no medication and you need to buy your medications for that particular condition. But if you are having a mental health condition, if you are loved at home and you are given the care and attention that you need, obviously with time you will fall back to track with the help of medications, of course. And my second point is mentally challenged individuals are already at the state of mentally health challenge, and there is nothing more. But people with physical challenges will actually develop mental health challenges because of the conditions they are having. Imagine you are a diabetes patient, or probably you have seizures, and every time you go out, people will be like, "Hey, kid, they done rabdi." Obviously, that's going to stigmatize you, it's going to traumatize you, and you are going to fall into depression. So I will say that in prioritizing physical health services in the national health budget, we are actually limiting the risk factors for mental health conditions. So I would like to summarize now to conclude. Honorable Speaker, I gave the definition of mental health and physical health. I strengthened the points of my partner and debunk on their points, and I've concluded. Thank you. Any POIs? That says it all. Okay.
The house is hot, right? Yes, the cooking continues. So we are all from Sami now. So now we're heading to the government member to come forward. So the government member, you can please come.
Honorable Speaker of this House and all that are present, good morning to you all. Lukman Said Bambua is the name. In my capacity as the government member, I shall give the structure of my debate. I'll start by debunking the baseless and the tasteless points made by the opposition bench, then strengthen the points made by the government bench, then bring my own points, summarize, then in summary I shall then conclude. Honorable Speaker, starting with the points made by the opposition leader. The opposition leader came here and told us that, in his word, I quote, he said physical health like diabetes can lead to amputation and may lead to mental health. Now, talking about this, according to him, physical health can lead to mental health. This is why us as the government bench believes that this house should prioritize spending more on mental health. Because if physical health can lead to mental health, that's tell you that we need to invest more on mental health. So that was the point brought up by the only point brought up by the opposition leader. So investing in the mental health is going to reduce even some of the physical health we are going through. Now, coming to strengthening the points made by the deputy opposition, the deputy prime minister, who said that it can lead to we need to prioritize mental health because of what psychological support. As we all know, we are lacking people who are specialists in this field. So because we need to invest in mental health, this will also enhance us in order to develop our psychological support. Now, going to my massive and explosive point. Now, starting with my first point, the reason why this house should prioritize spending more on mental health compared to physical health. One, because of insufficient specialists in mental health. Now, according to the Ministry of Health, January 1st, 2025, there are only 2 qualified mental health in this whole country. Just imagine a country of 2.8 million people. We are only having 2 specialists in mental health. So now, how do we expect 2 specialists in a population of 2.8 million to mend people who are mentally ill? Now, out of these 2.8 million, 2 out of every 10 in every community are having mental disorders. So just imagine if we are only having 2 specialists in this field, how can they treat people who are mentally ill? That is why us as the government bench, in my capacity as a government member, we would like this house to prioritize mental health over physical health. Because if we invest those money or the budget in training specialists, then we are going to increase the amount of mental health doctors in our country. But if we continue to prioritize physical health, then at the end of the day, the number of psychiatric patients or mental health patients are going to be rampant in the states. Now, my second massive and explosive point, Honorable Speaker of this House, is insufficient mental health facility. All of us here can testify that in a population of 2.8 million people, a country as big as Gambia, we only have one mental health center, which is the Tanka Tanka. So just imagine in the whole country. So if someone is sick, who is having a mental health problem in Kiam, we have to transfer him to Tanka Tanka. If someone is having a mental health problem in Banjul, we have to take them to Tanka Tanka. If someone is having a health ailment in Farafeni, we have to bring them to Tanka Tanka. Honorable Speaker, we need to invest in mental health. We need to build a lot of mental health centers in the provinces, in the city here, and in other places. That is why as the government member, we as the government bench will prioritize spending our health, our money, our finance in the health and the mental health sector. So this was also my second point. Now, moving to my third point, mental health patients, if left untreated, can lead to threat to society. Now, Honorable Speaker, these people that we are talking about, if we do not invest in mental health, this is going to be a pandemic, an epidemic in the country. As now we are seeing, 2 out of every 10 people in the society are having mental issue. 2 out of every 10 are having mental issue. So if we don't try to tackle this problem right now, then when are we going to tackle it? Then in the next 5 years, we will have out of every 10 people, 5 people will be mentally disordered. So that is why we need to prioritize in mental health. We need to invest. The government needs to invest out of 100% of the budget that the government is giving for the health sector. We need to use like 60% of that budget to spend it in the mental health sector so that we can find a way of reducing the population of mentally disordered patients. Yes, please.
You mentioned that physical health can lead to mental health, and because of that, you need to prioritize mental health first. Do we not start solving problems from the grassroots?
Yes, exactly. Because you people are not doing your work properly. So then we need to move on to the later part. Yeah, because we have been spending currently, is the government not spending over 80% of our budget in physical health, but yet still is still leading to mental health? So now we, as the government bench, are prioritizing now the mental health, because even though we are spending 80% of our budget in physical health, there is no result. So because of that now, let's prioritize the mental health. Honorable Speaker. So, Honorable Speaker of this House, these are the massive and explosive points I brought forward to this House. I started by debunking the baseless points brought up by the opposition members. Then I strengthened with the only point he came up was, which was 80% are having mental health. Then I strengthened the point brought up by the Deputy Prime Minister. Then I brought up my 3 massive and explosive points, which is insufficient specialists in mental health. Number 2, insufficient mental health facility. Number 3, mental health patients, if left untreated, can be a threat to the society. Then, in summary, I shall then conclude. Thank you.
Speaker, Abdullah Ijaju is the name, and I will start by giving the structure of my debate. I will start by refuting the arguments of the opposition, especially that of the opposition member. I will strengthen a point from the opponent government, and then I will strengthen the arguments of my government member. I will bring my argument, and then I will summarize, and in summarizing, I shall conclude. So, Mr. Speaker, the opposition made mention of a few things, 2 to be specific, that I will try to refute. The first one, somebody said mental health is not life-threatening. It's not life-threatening? You believe that? Right. So, Mr. Speaker, we want to bring to your attention that there are people that have health conditions that are a harm to themselves first before other people. So, to say that mental health is not life-threatening is a bogus point. Moving on to the second one, Mr. Speaker, almost all the members of the opposition agree that physical health leads to mental health. I agree with you. It leads to mental health. So, if physical health problems leads to mental health, shouldn't we then solve the mental health problems? And this is why, as it is now, the government is saying that our focus has been on the physical aspect of the therapy. Now let's shift attention to the mental issues as well. We are not saying do not treat the physical aspect. That is why the word prioritized is used in the motion. So we are saying treat the physical, but then we are going to shift more attention to the mental now. So this is the argument. Thank you very much. Moving on to an argument made by the opposition member, Mr. Speaker. She said that physical illness implies physical absence, but mental illness does not imply physical absence. That is to say, according to her, that when people are physically ill, they cannot show up to work, they cannot show up at your family ceremonies, they cannot show up to your birthdays, whatever. But then I want to bring to the attention of Mr. Speaker and the opposition member that we want nurses that are physically present but also mentally present. We don't want nurses that are treating patients that are easily agitated just because they have mental health issues. We want nurses that are challenged at the works to have a place, an avenue to go and get help. So this is why we are saying that we should provide facilities to help even healthcare professionals that have mental issues to get help and be treated. So to say that as long as people are not physically ill, then there is no problem, I think that point is bogus. So to the last argument, she said mental health can be controlled. I want you to transfer some of those capabilities to me, because I want to be able to control depression that most of us deal with. I want to be able to control PTSD. If you have the capabilities, you could please share with the audience. Mr. Speaker, following my structure, I have debunked and refuted the baseless arguments of the opposition bench. I'll move on to strengthening a point from the opening opposition. The Deputy Prime Minister mentioned that mental health yields physical health. I want to emphasize that point, because an individual that is mentally healthy would most likely be physically healthy. So this is a point that the Deputy Prime Minister brought in forward that I want to emphasize. Strengthening that point, I will then move on to now strengthening the points of my government member. My government member brought in three massive points. The first one is that we have insufficient specialists, mental health specialists in this country, and that is an undeniable fact. Only two in a population of 2.8 million. That is a ratio of one specialist to 1.4 million. I'm not talking thousand, I'm not talking hundreds, I'm talking million people. Mr. Speaker, it is as a result of this we are saying, let us improve, let us invest in developing the capacity of the Gambia to have more mental health specialists so that we can have specialists in every region, not only regions, in every district, not only district, but in every ward of this country, Mr. Speaker. Mr. Speaker, moving on to the second point, he said there are insufficient mental health facilities. That is true. The opposition member alluded that they are building another hospital that is meant to be catering for what? Physical health issues, but not mental health. And this is the reason why we are saying enough hospitals have been built for physical health issues. Let us also invest in hospitals that are meant to treat mental health issues. This is what we are saying, Mr. Speaker. So moving on to the third argument of the government member is that mental health patients, if they are left untreated, they can become a threat to society. I began by saying this, that they will be a threat to themselves first, but they can become a threat to society. How many of you have once been walking down the aisle in a village and then you have a mentally disabled person throwing stones at you or trying to stab you? These are examples of mental health issues that are left untreated becoming a danger to society. Mr. Speaker, moving on to my last argument, my argument is that, Mr. Speaker, that the Afrobarometer reported on January 5th, 2024, that 2 out of every Gambian has mental health issues. So because of this risk of it becoming an epidemic, we are saying, Mr. Speaker, that we should invest in mental health issues so that we stop it from becoming a national health crisis. Mr. Speaker, stating that argument of mine, I would like to summarize. I have started by refuting the baseless points of the opposition bench. I have strengthened a point from the deputy opposition leader. I have strengthened the massive and explosive points of the government member, which are insufficient health specialists, insufficient mental health facilities, and also mental health patients, if left untreated, will become a danger to society. I have given my argument, which is that mental health problem is becoming an epidemic in the Gambia, and we should cut it short. And in summarizing, I have concluded. Thank you, Mr. Speaker.
Good afternoon, everyone. My name is Paul Faketa. So, Honorable Chair, esteemed panel, and members of the House, today we face a motion that speaks on the core of the duty as a society. And that, I think, as nurses, is to advocate for our patients. All of us here, I think most of us here are nurses. What do we normally see in our wards? Do we see mental health problems? What do we see? We see physical health problems. So why are we here stating in motion that we should prioritize these mental health problems? Well, all of us, most of us here, in our homes, in our wards, we see that our aunties, our moms, our uncles, our grandmoms are all being affected by these physical health problems. Why should the government put millions and millions of dollars in these mental health problems when we have these problems? Why are we focusing on small problems when we have these big problems? Today, I'm going to talk about on this point why I'm going to stand by the motion why physical health should be prioritized. Number one point I'm going to talk about is the increasing numbers of these health problems. Looking at the Ministry of Health and the UNICEF, the Gambia, physical health problems affects our people. We even see it in our wards and in our homes. While we agree that the principle that mental health problems are important, but we are a country of 2.8 million. Compare that to other countries. Compare that to other populations. Why should if 2.8 million people are being affected by physical health problems, why should we prioritize the mental health problems? on mental health. Have we forgotten that us nurses should advocate for our patients? Why would we like to ask? I would like to ask the audience, myself, which health problem should we advocate for as nurses, in our homes and in our wards? What do we normally see? Mental health problems. So why are we here saying that we should prioritize this? The second point I'm going to talk about is that I've seen they're talking about treating mental health. Well, a study have gone around in the world the study was concluded by World Health Organization that mental health problems cannot be cured. Something that cannot be cured. Why are we spending millions and millions and millions of dollars there?
So, cancer cannot be cured.
We are talking about
Yes,
mental
cannot be
problems.
cured.
Mental.
Can you just forget about them and not do palliative care for them?
Okay. You're saying that I'm saying about mental health problems, depression, anxiety, and the others. I'm saying they cannot be cured. They only can be treated. A person that can only be treated and a person that can be cured, which one would you favor? The person that can be cured. Why are we then using all our resources to go for physical health problems, mental health problems? And then I'm going to talk about the economical factors. Countries around the world, like America, developed countries, have spent millions and millions of dollars on health services for mental health problems. And what do we see? They have failed. We see that most of the killings, the mass shootings, the rapists, all of them are what? They have mental health problems, and they have spent millions. So us that are underdeveloped country, if we spend all our resources on this, and what is the probability that we're going to win this? What is the probability? Let's just face the facts. We are in the no, not taking. Like I said, countries like the developed country have spent millions of dollars on mental health services just for them to have increasing crime rates on these mental health problems, proving how they have failed even with having all these funds and these studies on. So why us Gambians should we use these resources to prioritize mental health problems? While we have these small problems like physical health problems, we have diabetes, we have kidney problems, we have cardiac problems, our aunties. So I just don't understand. I would like to also talk about. Okay. So I'd like to also talk about focusing on the small problems. I would like to emphasize more about that. In the country that is the health is very limited, the resources are very limited. Why should we then take our resources and put it on these mental health problems? If the probability of us solving these problems is very low, I think we should prioritize the mental health problems, the physical health problems first, and then if we have succeeded, we have not even succeeded in that, because we see in our world, in our homes, that physical health problems are increasing. So why I don't see the need for us to put all our resources in these mental health problems. Like I said before, as nurses, we should advocate for our patients. Let us try and do that to build a safer and better Gambia and healthier one. That is to advocate for our patients. That is to advocate for the type of diseases that are being affected by our people, not to follow people just because they are putting millions on these health problems. Let us just follow them. Let us see what is affecting us in our country and focus on those things. Thank you very much.
So if it is one saying, Mr. Speaker, I want to give my submission, you will listen. If it is me, yeah. I also wanted to give my submission, and I wanted to give the structure of my remarks, if you will listen. Yeah, actually, this is a very difficult thing for me to give closing remarks. I prefer giving opening remarks than closing remarks, especially for events that you have been anticipating for. My council members know that about 3 weeks we started planning for this event, and alhamdulillah, it's a success. And now we are saying bye-bye to you. Though we are going to meet another time, but there are others, we might not meet them again, especially those from the other schools. So it's a difficult thing to give closing remarks. But as the saying will say that whatever starts must end, right? Good. So on behalf of the 10th Executive Council, I, Boubacar Diallo, as the president of the Nurses Students Association, sincerely thank all those who we invited and that they respected our invitation. If I have to count, I might have mistake, but I will just try. The likes of the radio station, the TV station, QTV and Fine TV here. These people, the moment you text, I'm telling you not to talk of call, text message, they reply, they came. And some of them, if I'm to shock you, some of them, they just come without even telling us prices. You get the point? The likes of Dr. Jah, you saw when Maha read the biography of the man, right? So those kind of people responding to our calls, I think it's a big thing for NSA. If you look at the turnout today, our welfare ministry was shocked because we were not even expecting this turnout. Right now, as I'm speaking with you, as I'm talking to you right now, I'm on empty bag standing. I'm not eating because the welfare has not taken care of my welfare. Because the turnout, we were not expecting it. So this is a big thing for NSA. Usually when we call, students do not answer. And I want to bet some of you do not even know that today is an NSA day that we are celebrating too. Not only the Nurses Week, right? Because it's in our constitution that in the Nurses Week, and NSA Day is celebrated. So we do it once, celebrate the Nurses Week, celebrate the NSA Day. And it should have been a better celebration because it's a decade-long existence. We are in our 10th year, right? And previous councils, we have seen a lot of loopholes, but it's like now we are trying to amend that. Just to cite few. In the executive level, we've seen in the previous councils, when election happens, there are some executive positions. After the election, they will have to appoint other members because students will not even vie for the positions. But look at the past one. All 10 executive positions were applied for. Last election before last, we even had some opposition. So it's something commendable of NSA. And as I always say, together we can do it, right? Together we can do it. In unity, we can achieve the unimaginable. And it's like I'm seeing that. And I'm hoping on all of you to continue with the spirit. We have a lot of remarkable events that we will organize for you people. Only if you turn out, then the event can be successful. So we are very much impressed. We thank you for coming. We thank the media houses. We thank the poets. We thank everybody who came here because all your inputs made the event a success. Thank you all.